Welcome everybody to my next episode of Jumpstart Distilled. I have a wonderful guest today, Jay Naddis with Topco. Jay and I have been connecting over the last, year? Does it feel like
How
that?
about that?
Or about a year. And he's taught me a lot about innovation in health and wellness in kind of the grocery, pharmacy, retail space. Jay is an expert in this area, so I wanted to invite him to join a Jumpstart Distilled discussion to talk about the future of health and wellness innovation in grocery and retail. Again, I already said this at the beginning, but if you do join or are just now joining, make sure you're on mute throughout. There is a point at which I will open up the floor for questions, so be thinking about what your burning questions for Jay might be. We will open this up into kind of a group discussion, so I'm excited about that. But we'll start just with some basic questions, Jay, about your work and what you're seeing in the space. But before I go any further, I would love for you to just quickly introduce yourself, and doing so much better than I would be able to.
Well, you got my name pronounced right, which is always the first step, right?
Well, that's
So
what you get for knowing someone for a year. So
there
got
you
that
go.
out of the
There you go.
way.
So good afternoon, everybody. So as Eller mentioned, Jay Naddis here. I am currently the Director of Health and Wellness Business Development at Topco Associates, which is a member-owned cooperative based out of Elk Grove, Illinois. It's about 10 minutes west of O'Hare for those people who are familiar with traveling in and out of that airport. I'm a pharmacist by trade. Actually, I've completed my doctorate in pharmacy, but I consider myself a health and wellness enthusiast by passion. And what that really means is that as a pharmacist, people they're typically used to pharmacists recommending medications. I am actually the anti-drug pharmacist who believes that lifestyle modifications should always be pursued before, during, and after any type of diagnosis to try to minimize any type of medication usage, if at all possible. But I also believe that once you're on medication, that it's really important to manage your medication along with everything else that you're working on in your life. My background, so as a pharmacist, you'd ask the question, how am I now working in health and wellness? Actually, I have 25 years in retail as a pharmacist. So worked at Walgreens for 20 years, and at Walgreens, I worked on the bench. So I was actually managing a couple of stores before I moved up to Walgreens Corporate to help with some of their product development. Had a great 10 years in the product development space there. And that's really where I started cutting my teeth on working with startups. Absolutely loved it. You guys have just an amazing life filled with lots of constant everyday pressures, as well as innovation opportunities and the opportunity for passion to shine through. So I really had an opportunity to get to know a lot of startups, and I worked with a couple of incubators and accelerators in my time there. I left there during the Boots acquisition, primarily because they were looking at went a little bit different direction than I wanted to go. But I used the opportunity to strike out on my own. So I myself am a small business owner. So I started out a small consulting firm. And really the benefit of that is I got to pick and choose who I got to work with. And I primarily worked again in the startup space, working on advising certain startups and those companies in growth stage. My kids always ask, what is it that you do? And I said, I help companies figure out what they want to be when they grow up. And so that was always fun.
Love
Top,
that.
yeah, Topco was one of my last clients, and the same thing there, was working on health and wellness business strategy. And they slowly started buying up more and more of my time until they made me that offer that I couldn't refuse, which primarily meant that they said, hey, we want you to continue doing what you're doing, just working for our members. So just a little brief background on that. So our members are primarily grocers. We do have about 50 members, give or take, every couple months. It shifts. Our members own us, so we are a nonprofit organization. Any money that we would make, we redistribute in the form of dividends or repatriate to our members. As such, they do dictate a lot of what we do, but they also dictate somewhat openly and broadly. So in my case, it's really, hey, help us get to the cutting edge and bring us some new opportunities. So all in all, the theme across everything I did is really focused on health and wellness consulting and really focused on early stage and trying to find the new and the next.
Amazing. Amazing. And so I know that was, your background for all the way from pharmacy to retail to literally the exact combination of those two. Well, I would say more grocery retail.
It's both. You're right,
but
though.
but both, like, you're in an amazing position now. But something that, again, we've been talking for over a year, and we talk a lot about health innovations, really what's interesting, what's new coming out of the Jumpstart Foundry portfolio, what pain points are your members experiencing. And so again, I appreciate your background, just you in general, but I do want to invite you to actually talk about your literal background here, in your Zoom window.
Yeah.
It's something that I think it orients every single conversation that you and I have had. But I'd love for you to share with everyone on the call what your background actually signifies and what those pillars for Topco mean and what it means for your work.
Yeah, and I think you're spot on. This really helps me with accountability, as it is, with everything that we do in life. Keeps everything in front and center. It's very transparent. You guys know what I'm working on. I know what I'm working on. And if it doesn't fill in one of the buckets, it means that we probably shouldn't be working on it. It is quite broad, but they also have their purpose for being called out as specific pillars. So largely where these pillars came from, just so you know, is our membership a few years back saw the zeitgeist, that is health and wellness, really being the current big thing, and grocers, weren't sure where they can actually fit in that area. I would say now they're very clear where grocers fit in health and wellness, because again, and I'll share some of these stats with you, but the grocery store falls higher than pharmacies and doctors and insurance companies even now, as health and wellness allies. So, basically, the way to boil that down is, if I'm feeling sick, I'll go to a doctor, I will go to a pharmacy, I will look on WebMD, etc. But if I'm feeling healthy and I'm feeling well and I want to continue feeling that way, this is where people tend to celebrate more. And I'm going to go to the grocery store, I'm going to buy a fresh meal, I'm going to pick up a salad or ready-made salad or whatnot. So that's how they consider grocery stores as supporting me with staying healthy. So these 4 pillars are what we put together to try to maintain that. If I start all the way on the right here, my hand disappeared. There you go. Nutritional wellness is probably at the core of that. And that's because grocery stores have an absolute right to play and win in this space, since they are supplying a lot of that nutrition, whether it's online or whether it's in stores. There's a lot we can do there. Over the past year, it's been a little bit more impactful. People are looking at grocery stores as one of the only destinations that they were visiting over the pandemic. So there was a little bit more pressure falling on us to try to make sure that we hit on some of those nutritional wellness points. As far as programs go, if you've shopped diligently within a grocery store, you'll see that there are nutritional panels on the back of an item. What a lot of grocers are doing now is they are collecting that information as well as collecting what's inside the box, as it were, with the ingredients, to create attributes and attribute programs. There are a lot of scoring apps out there that you can download that will then rate your basket based on how you're eating. And those are interesting apps, to say the least, because you don't necessarily want to make sure that your Oreos show up on that basket, because it might actually hurt some of your points, right? But so there's a lot of innovation going on in the nutritional wellness space. Dietitians are such an underutilized skill set. So I know we're working with a couple of startups on trying to gain exposure there. Obviously, this went very much down the virtual side with COVID. And so we've helped our members start expanding virtually there as well. So if you were to find some of our members online, you could look at some of their websites and see some of the great innovative stuff they're doing in that pillar. The second one here, innovative solutions. I can't give too many examples here, because this is where we actually do have a lot of relationships with startups, including some Foundry folks. So I can't give a whole lot of specific examples. I'll say that the biggest one by far, though, in the last year was focused on COVID.
Mm-hmm.
And there were really three big product lines that we launched there. One was telemedicine right out of the gates. A lot of members didn't have anything in that space, and if you've seen some of the stats, it was catapulted forward 5 years as far as evolution of telemedicine and telehealth in general, really growing 6,000% at one point in time. COVID testing, again, didn't exist, had to evolve very quickly. The FDA had to shut down a whole bunch of things that were happening unregulated. And we created some partnerships through that muck. Working from home, my basement here behind me is filled with a bunch of COVID testing samples, for example. COVID vaccine, then, we developed a relationship with the CDC, to get more vaccine to rural areas and pharmacies within grocery stores who may not have ordinarily even shown up on the radar, since, again, everybody knows Walgreens, CVS, and Walmart, but they might not have heard of, King Cullen, a small grocery store out east, or Acme Albrecht, a small grocery store outside of Akron, Ohio, right? So by Topco coming together, we were able to play well there. We do that same thing, by the way, for a lot of startup growth as well, and a lot of the other innovative solutions, and we'll talk more about that here in a little bit. Shopper growth and retention is the pillar here that talks a lot about data. And so we do much in here to track the data on, who are our customers, what is it that appeals to them, what programs align with that, and there's a lot here tying the pharmacy with the front end, to your point, Eller, right? There is a key crossover there, and we know that the typical pharmacy customer spends anywhere from 3 to 5 times more than a non-pharmacy customer in the grocery store. So anything that we can do to gain pharmacy shoppers when it's needed, and then cross over and cross sell to the grocery side makes a lot of sense. And then finally here, cost savings. This one's pretty obvious, but it does actually contain our 800-pound gorilla, which is we do have a prime vendor agreement in the pharmaceutical space. We are currently the second largest purchaser of pharmaceutical products, and the fifth or sixth largest overall. So we have a lot of buying power there. From a scale and commitment perspective, there's a lot of value there, which also directly applies to what we do here on the Foundry stuff as well, which is, we can gain alignment across multiple members, get commitment, and help with the scale, certainly, in certain elements. Aside from that, on the cost saving side, so we have 2,300 pharmacies that are currently bundled together in a purchasing agreement. Our members have about 15,000 storefronts. And from an employer group perspective, they have about 600,000 covered lives, not including growers and pickers, which you can imagine in the grocery space. And we have a lot of seasonal help that come in and either are picking a product or helping during harvest, et cetera. So there's a lot of opportunity there to capitalize on scale.
Love it. Love it. And so before I get to my next question, I do want to invite those that are attending. If you have questions that pop up for Jay, you're welcome to quickly jot them down in the chat feature. I will read through those, or I'll invite you to come off of mute here in a little bit. So as questions pop up in your mind that you really want to ask Jay, please submit those in the chat. So Jay, first of all, thank you for kind of walking through each of those pillars. It's always helpful, even to me, to review each of them. I'm curious though, for founders and those on the call, as you are kind of serving as somewhat of a filter for innovation going to your members and making sure that they then filter through one of these pillars, what are some things that maybe you see founders or early stage companies doing that is maybe, I always hate kind of saying a total mistake, but almost a misstep or misunderstanding, even when they are first pitching or potentially thinking about how to enter into grocery or pharmacy retail? Because a lot of times these innovations, is a lot of the ones in the Jumpstart portfolio that we've discussed, are not, they're not, they don't immediately come to mind to say, oh, that's a perfect innovation for a grocery or retail setting. So what are some of those maybe missteps or misunderstandings that founders might have that you see most often when you first come across them?
Yeah, and I love that question too, because and this is not just specific to Topco, but my experience before that in consulting and then at Walgreens. Uh, there are certain, and you could call it a misstep, but you could also call it a learning opportunity, and hopefully I can help you guys get there quicker than having to learn the hard way.
Yeah.
Yeah, so for example, at Walgreens, one of the startups that I worked with after I left Walgreens, they came into the pitch with they are the only solution that this solution is the best thing that has ever graced Walgreens stores and how it's going to single-handedly change the world. So I think one of the missteps there is that they're not looking at it specific enough. They didn't do their homework either. For what it's worth, it was a biometric station, and we had literally just trained 26,000 pharmacists on how to conduct blood pressure tests and had touted the fact and through press releases that the pharmacist is your greatest source of biometric information and an entry point into what happens next. So the fact that they could have, done a little bit of research going into the pitch and saying, "Hey, I just saw a press release and I see you're doing this. I feel like you're going to hit this saturation point where you're going to need help. And here's where my product can step in there." And then to my earlier point, we're not the only product on the market, but here's how we differentiate ourselves from other people in the marketplace. So I think, kind of the misstep there is not knowing who the client is, not knowing, potentially what they're doing in the space, underestimating the marketplace in the pitch, not knowing their customer and the competition is kind of a misstep. The other thing that I'll say though, it has a lot to do with flexibility. Uh, we, I love the ideas that come through Foundry and other areas, and they come from a source of passion, and passion comes with, the assertion that this I know how to do this, but they may not necessarily the startups may not necessarily know the audience, who the end consumer may be, how the logistics or the environment works, and so the ones that come to the table and say, "Here's what we had in mind. Got a couple of options, but ultimately, I want to hear from you, what you need and how you think this works, and let's work together." Much faster timeline, and much more likely that the pitch is going to be successful.
Interesting. So maybe another, just a quick follow up to that being, how can founders, I guess, best position themselves, or whether with their pitch or talking about the partnership structure or business model with pharmacy retail? Like, what are the things that you think founders should think through before they have that first conversation? If, say, for example, they have customers in other segments of the industry, and grocery and pharmacy might be a new market for them to start exploring. What do they need to hit on when thinking about partnering with retail?
Yeah, I think transferable knowledge is, kind of putting it out there. Here's what we know,
Hmm.
and here's what we know about your industry. Here's what I know about my product, and here's what I know about how successful it's been in other areas, or in test subjects or whatnot. And then working together to understand, what is it that we believe together, right? So I feel like this could work in your environment, but I really am open. I would like to have a conversation with you. So that's that opening pitch, to work together and partner, as opposed to I feel like this product should go on your shelf. So I
Yeah.
really like it when people come to the table and say, "Hey, I've got a great idea. It's had some great success elsewhere. I'd love to see if this actually has the opportunity to play. And then here are some thoughts I already have, but I'd like to bounce it off of you." So
Yeah.
having that kind of white space discussion is a really good way to start that conversation.
That's great. I think for a lot of the Foundry companies, I think that's been very useful. I try to tee it up in that way for many of them, saying, you may not have thought about this, but this is an interesting conversation to have, and it could open a lot of doors that you didn't even know existed. So, in that vein, I really see, and I know in some of the email invites I sent out, like, I see, grocery and retail being the kind of front door to health and wellness. It already is the front door, but even more so in the coming years. So I'm curious just to get your take on where you see the future of the grocery store and the role it plays, I think, in the consumer's life, and if you want to pinpoint to the patient consumer.
Mhm.
Um, where do you see that evolving over the next couple of years? What are kind of near term changes that might happen, and maybe long term effects? Just curious to get your thoughts on where we're going.
Yeah, no, I love it. And I think that what's interesting is that had we had this conversation 3 years ago, it would have been a little bit different.
Right.
I think pretty much everybody knows the quote, let food be thy medicine and medicine be thy food at this stage. 3 years ago, it was a lot of, oh yeah, I remember that from grade school conversations. But food as medicine is definitely where everyone is applying some of their focus. Um, just to be clear, though, that's only been officially, defined across the industry in the last year or so.
Right.
And really, it looks across three different areas. It talks about the fact that food as medicine can treat certain conditions. There are literally people who are stopping diabetes medications because they no longer have diabetes. Something a decade ago, decades ago, it was unheard of, right? Once you had diabetes for life. But you can actually reverse diabetes with diet and exercise.
Hmm.
You could definitely also prevent. So the second one is prevention. Food as medicine can prevent developing certain disease states. And then the third pillar really of food as medicine is helping people afford healthy foods.
Yeah.
So there's a lot of food pharmacy out there across the country where literally physicians and health systems are writing prescriptions for healthy foods, so that you don't have to choose between a cheeseburger, which you can get for $1, and you can't even buy a pepper for $1, right? So some of those decisions are no brainer when you're on a fixed budget. So if we can give you a preloaded debit card that only works for fresh items, for example, then you're allowed to make some of those decisions and start balancing your plate, as it were. So food as medicine is definitely one of the biggest trends out there. Anything you can do to tie to that is good, because 80% of shoppers are saying that they're willing to spend more on their overall health. They're willing to, again, vote with their dollars and explore different items if it helps support their overall health and wellness.
Hmm.
The interesting thing is, though, that half of them don't know how. So that's where we look at it from an education perspective. Again, that food as medicine piece is crucial. Food over indexes as a remedy for 8 of the top 20 conditions. So over indexes, meaning that it's the only solution. But there are in other areas where like food for mood, lots that can go with that. So it's really about what can you look at within the four walls of the grocery store that can help either feed, pun intended, the food as medicine movement, or can it bolster it? What other products that you can wrap around that? There's a lot going on with personalization and transparency. Personalization, we're seeing that go into the genetic space. Folks are doing genetic tests to find out that, hey, maybe keto doesn't work for me. And it's not because I'm horrible at following a keto diet. It's because genetically speaking, I actually really need carbs in my diet to stay, well balanced. And so now, how cool would it be to tie that genetics into my shopping list? And now I can actually start filtering based on certain attributes. Nutrient dense attributes are getting a lot of feedback all across the country. So it's really focused on a lot of that. What else can we do to arm the consumer to make better self-care choices?
Great. Yeah.
Yeah.
Yeah, and I think that that evolution of self-care, and whenever an individual enters the grocery store, they are making choices on their own. How can you, so I'm curious actually how in innovative ways that you're seeing your partners help consumers make choices when they're physically in the store. I know you've talked about the apps
Mhm.
and kind of the digital basket, but curious just what your thoughts on like actually helping the consumer choice physically in the store. And then I know we have a question coming in, so we'll get to
Yeah.
those just after this. And then anyone else, please feel free to chime in, and we'll have a nice conversation.
Yeah, so I'll go back to that one stat. So, 80% of shoppers are willing to change their shopping habits and
Hmm.
spend more if they knew how, but more than half of them don't know how. So really, it's all about education. And when you're in a store, education is difficult. I know I'm one of those that is really mission driven in the
Like
shopping trip.
you had, I don't know about you, but I lay out my list. I know by section. I'm not crisscrossing. I'm going through. I'm going to get it done. Yeah.
Yeah, so we have education sessions that say, okay, next time you make a trip, here are certain things that you should look for. Also, if you're able to filter your shopping list, so you know which products to choose based on your health goals, that's
Mhm.
fantastic. And then looking for specific shelf tags. There are tons of shelf tag programs out there. I think one of the opportunities is to kind of narrow those down and be a little bit more descriptive, and even having some of those custom attributes readily available. We talk about the fact that most shoppers don't shop for just one attribute. So I think you and I made, to your point, have a clear idea of what we need. But most people, most households are shopping for multiple health conditions, food allergies. I mean, we're an example of that. I'm lactose intolerant. Happy to admit it. Don't buy milk. But that means I can't eat certain things like macaroni and cheese, which is a childhood love of mine. Found out there's a product, however, that I can use, and now I love mac and cheese. But when we shop, now we shop two different types of milks, for example. So it's a lot of it's education. It's really about making it easier for next time, which there's a behavioral change there. I feel like I've been shopping well up until now. So how do I get the shopper to admit that, okay, I really I don't have any idea what I'm actually doing. I just keep buying the same things over and over again. And once they make that change, how can I help them create new lasting habits?
Yeah. So I think that's a perfect segue, at least into Raul's first question. So I will invite you to come off of mute and ask your question about health and wellness coaching platforms if you are comfortable doing so. Yeah.
Yeah, absolutely. Yeah, number
Awesome.
one, thank you guys for putting this together. This is awesome.
Great.
So we're a startup. We've been around for about 10 months. We're called Reviving Mind. We're effectively a platform that connects consumers currently with health and wellness coaches. One of the, call it differentiators. We're not the only people doing this in the world, but one of the differentiators is group support. We found that by integrating group support, private curated group support, I should say, with lifestyle medicine coaching, the outcomes are phenomenal, right? The retention is outstanding. It's just, I mean, I can get into the data, but just the outcomes are amazing. So now thinking about kind of grocery retail in the way that you guys are talking about it, I suspect, a lot of automated coaching systems are things that a lot of retailers would be interested in. But from our investigation, when it is married to real life coaching and support systems, the actual outcomes again are just that much more, just that much greater, right? So given that we have kind of a hybrid automated coaching system that is really more of an assistant to the actual health and wellness coach and feeds into the actual group mechanism that we have. How do you think a service like ours can partner, with a grocer, be it a regional or a larger chain ultimately? Thank you.
Yeah, first of all, thanks for your question, and thanks for what you're doing, because ultimately, I will tell you that if it wasn't for personal connection, pharmacy would have been dead years ago. They predicted that automation was going to replace the pharmacist. When I went to pharmacy school back in 19, right? So the point is that you're spot on. It's the personal connection is absolutely crucial. The trick is getting folks who are very aware of the money value of time to give up some of that time, and I think that's where we've seen, influencers have a lot of that in place. But again, what you're trying to do is make that readily available. I will tell you right now that we have grocers across the country today offering similar services, because they understand that I may not have a lot of time when I'm in the store shopping to talk to someone, but I'd love to follow up some questions. And
Right.
Whether it starts with a chatbot that leads to a person, or whether it starts with a subscription program where I can actually talk to someone over multiple sessions, they definitely see the value of having that personal connection. So how to get in to talk to a potential grocer is identifying, first of all, do they have a solution? And is yours a better, bigger mousetrap? Or is it different and can augment? If they don't have a solution, then it's really looking at their competitor across the street and what do they have to offer that you can actually help them have some table stakes and being different from the groups across the street. And then if they don't have any competition doing it, that's sometimes the hardest leap of faith, right? You may not feel like you need this now, but let me show you some case studies of where this has actually gone down, down the hill. If you went down if you had the wrong decision, you made, you've been put out of business or whatnot. So that's kind of where I would go. So yeah, I think you have a great idea. I would not relent. I'd keep going and trying to break down some of those barriers.
Fantastic. And very, very quickly as a follow-up, if you don't mind, I know kind of margins for grocers are pretty rail thin, right? And so
razor thin, yep.
From a spend standpoint, again, we have a human-centered sort of service, right? So how do they sort of think about spending money on services like this? Is it more so around sort of retention of the customer, right? Obviously, if they partner with somebody like us and they've subscribed to our platform, they'd really only get services through us if they were continuing to be perhaps a member of their grocery chain, right? Or something to that effect. So just trying to get more visibility into how grocers think about partnerships like this. Thanks.
Yeah, no, and it's a great follow-up question. What I would look at is there are really three types of metrics that do a lot of the talking for you. The first metric is really about engagement. So how many people did you offer to that ended up taking it on? The next one is, more long-term engagement. So how many people stayed with that? And then the third one is health outcomes. We know health outcomes are very difficult to get to. Believe me, on the pharmacy side, I've been trying to prove medication adherence value for a couple decades. And it takes about 18 months to be able to show a lift one way or another, which that's a huge expense to run a pilot for 18 months. So that's why you need those other two initial indicators to go in there and say, listen, we've seen this in an environment generate this kind of uptake, this type of long-term engagement, which will lead to these types of outcomes for you, which translates to dollars and cents. So I think it's coming in armed with those types of metrics if you have them. If you don't have them, then this is your pitch. I'd like to pilot with you. And this is where you say, I'm ready to roll up my sleeves and work with you. Heck, I'll be in the stores. I'll flag people down. I want to find out what are those key assumptions on those initial metrics. How do we meet some of those? Let's find out what those are. And then let's make some pro forma recommendations down the road. So to help?
Yep, absolutely. Thank you.
Fantastic.
Awesome. Thanks, Jay. And thank you, Raul. Those are great questions. Any other questions coming from the group? Anyone is welcome to come off of mute and ask a question. I know we've got.
Yeah, I'd like to ask
Michael,
a question.
go ahead.
Yeah. So again, thanks both of you all for entertaining us and educating us today. I'm with a life science company. I founded a company 6 years ago with an amazing leadership team, past president of the American Medical Association, past chair of the Assembly of the World Health Organization, chair of functional medicine at Cleveland Clinic. These are all our chief science officers, assistant professor of nutrition at Baylor College of Medicine. So we're completely behind food as medicine, which is how we started. But at some point, like all startups, you have to make the cash register ring. You got to generate some revenue. So, we're researchers, we're scientists, and I'm not, but most of my team is, and we, have developed and patented technologies that will improve outcomes with food that will contain our proprietary compound. Now, we don't know about getting brokers and distributors and agents to help us get into retailers. That's not what we do. So my question is, with a group like yours at Topco, do retailers, grocers prefer to have only brokers and distributors and agents come to them, or are they open to us sitting down and sharing with them our personal stories and the things that we're working towards? You know, our global view of you know, better for you foods. You know, there's lots of people doing great things out there in the better for you foods category, but let's face it, not all of us can afford a $10 jar of peanut butter, right?
Mhm.
We can't all afford $3 you know, snack bars and nutrition bars. Keto's great, but boy, I mean, it's $200 or $300 a month. I know people say, oh, well, it's not if you know what to buy. People don't know what to buy. So,
Right.
you know, I'm curious, you know, if there is the opportunity, or is it frowned upon to have a direct conversation with a grocer, medicine, health, um, the pandemic, it's all politicized right now. And I would think that the local grocer would be someone that I can still trust to help me and help my family stay healthy, stay well. And I would think that they would be open to a one-on-one dialogue about what we have, how we think we can help improve the lives of the people in their communities. I don't want to spend months and months and months trying to figure out who's the right distributor, who's the right agent, all that. I want to just figure out how do I get to the decision makers and the folks who, you know, can help us, you know,
Yeah.
contribute to health and wellness in communities.
Yeah, I think your question is a very strong question that has occurred a lot. Um, and I'd say anywhere you have an ear is a good place to start. Grocers are absolutely looking for this type of a conversation, but they don't necessarily know how to filter some of them. There are really three types of grocers out there. There's the independent, there's the regional, and then there's the, you know, the nationwide. Then you have mass marketers, et cetera. But those aren't, you know, grocers by core foundation. So when you look at independents, that's where you almost are better off going to a trade organization like an IGA. If you're looking at regionals, the regionals tend to be a little bit more, you know, top-down strategy. So it's the, you know, the CFOs, the CEOs, you know, and many of them are family-owned. So sometimes it could be the person who golfed with the friend who's a sister of the CEO, right? It's those kind of connections you get to play. But that's where they also look to buying groups such as Topco, and there are multiple of them. So Ahold has the buying group, you know, Topco does. You've got Southern Grocers, Northern Grocers, right? So there are multiple associations that tend to filter these things out, and absolutely they're looking for this type of a solution. The brokers themselves and the logistics, if you're able to get down that path, that's the easiest play to get it into the store and on the shelf because everything else is figured out. But you know, the logistics on the, you know, do I really want to do this? That's, you know, it's a little bit of a harder play because, you know, they're just assuming it's just another product you're pushing. So I'll go back to the way I started this. If you have an ear that's listening, absolutely use it as best as you can. You know, and I understand it's hard to spread yourself thin, but try to, you know, put a baited hook out there in all different directions and see who's looking. And then ultimately, once you have that ear, really focus on that ear for a while and see if it plays out. I'll tell you, if for example, you came to Topco and we were able to get a store or a chain on board for a pilot and they find that it's beneficial, they will figure out the rest on the logistics and getting everything else into play.
Yeah.
And then it becomes a collaborative effort. Like, hey, we should introduce you to Emerson, or hey, you know, we should get you a McKesson Medical, or wherever it might be.
Super. Yeah. I mean, we're just, you know, we're, I don't know if I'm still on.
Yeah, no, you're good.
You can hear me. Yeah, one of the things that happened during the pandemic is that all the major universities where we do a lot of our work basically shut down. They wouldn't let us come in unless you're working on COVID. You couldn't come into the lab. Yep. So, you know, we said, hey, let's go see if we can do our part. And sure enough, we came up with a naturally derived compound that shows antagonism against the spike protein, which causes us to be infected by this virus. And people go to the grocery store and they buy elderberry and they buy vitamin C and all these other things, but those things have nothing to do and there's no one there to tell them that, great, buy this stuff, but it's not going to help protect you against this virus, and so that, sometimes I don't know. I mean, I think that's part of the challenge for all of us, right? Just as individuals, knowing what's good, what's not good. And I don't know, like I say, I trust my local store more than I trust the big box, because I typically go to camp or church or whatever with somebody in that store. And so that's why I'm so happy to be here with you, because you've got insight on, these independents versus the big box. Not to say there's anything wrong with the big box. There's nothing wrong with them, of course, but it's an easier launch, I would think, than trying to go to the big.
It is different, I will share, because the bigger box ones will be able to assemble a team if they think this is worth pursuing, whereas the regionals, it's beg, borrow, and steal. And then the independents, it's, well, I gave it to the stock clerk because he's not doing anything right now. And I'm kidding, of course. But it's just the wide spectrum of how they work. That's where, that's the benefit of working with someone like Topco. So our members hired us basically to kind of filter through, as Eller mentioned, the already filtered products that, the Foundry has brought to the table. And it makes it that much of an easier conversation to get it in front of the powers that be.
Super, thank you.
Well, great. Well, we probably have time maybe for one more question, but I do try to keep these right around 45 minutes, maybe a minute or two over. So if anyone has a burning question, I invite you to come off mute, interrupt me, ask now.
Okay, I'll come off mute, and I'll even put my video on
Hey, Paul.
Hey, how you doing?
Good.
Good. This is very good, Jay. Thanks for coming here and volunteering your insights. So my question, our company Freckle has been doing work with in the grocery store space for quite a few years around nutrition and with dietitians. And in fact, a number of your customers or your members are customers of ours who have had dietitian programs. So I think we had maybe something like 70 or 80% of the retail dietitians in the country that were doing sort of consumer facing stuff were on our application. And our observation has been that as retailers have been sort of figuring out how they play in the space, the idea of providing personalized one-on-one services to consumers with dietitians seemed like a good idea, but it doesn't fit the sort of high volume, low margin business model that they have. So I think it's hasn't really sort of gotten off the ground a lot in a lot of different places. But so we've sort of been migrating to other industry sectors, but we have a product now which is a meal planning application. It's kind of a decision support tool for health professionals, dietitians, physicians, using artificial intelligence to create personalized meal plans for individuals. So based on their health needs, and we can pull information out of the electronic health record and use that to understand the health needs. And we've got a bunch of ways of picking up personal preferences to sort of personalize that meal plan around those preferences. And we generate the meal plan, and then because we're working with health professionals and they're working with it, they get a chance to kind of make some corrections, and so our system learns continuously and gets smarter and smarter. So we have this kind of artificial intelligence of the dietitian that can create the meal plan. Now, instead of taking an hour, you can do it like this. So one application, and I'm asking you if there's a pitch here for, if you understanding where your customers are at and what they're looking for, we see there could be an opportunity to deploy something like this through their site, let's say, and consumers can generate their own meal plans that meet their health needs and then create the shopping list that goes with that. So we create the shopping list. And you have a way now for a retailer to have some of the benefits they thought they were getting from dietitians giving consumers advice, but now you can do it at scale, which they couldn't do with the individual dietitians. So we're thinking about taking another swing at the supermarkets with this product, even though we're primarily today focused on health systems and health plans. But just with that bit of information, do you think that would resonate with customers, or would we be spending another year of pain and suffering trying to get anybody interested?
Yeah, I think the short answer is yes, there's always an interest in this. I think it's always the next 6 questions that probably, to your point, create some of that heartburn. I think anytime you're looking at automation, to Raul's original point, it's how does that integrate with the manpower there? So how does it not get perceived as replacing an important role? So I think folks could say, okay, this is easy. Like, then we don't even need the dietitian anymore. We put it on the website, let them generate it themselves, and then click add to cart. Everything's added to the cart, shipped directly to me. I don't even have to worry about this. And that doesn't play really well with the threats from the West, right? The Amazons of the world who are trying to automate everything. So it's how does that integrate with the in-store grocery experience? But I will also say that, and I know you touched on this early on, which is that there's a questionable value to that person that's there. I will say a lot of that actually has to do with the fault of the programs up until now, not having an evaluation criteria to prove an ROI.
Mm-hmm.
So if you can actually assist with helping the very same people who would use your product develop an ROI for their own services, now you have an ally, and that ally will sell your program for you. You don't have to worry about it as much. So that's kind of where I would say, if you have that opportunity, then let's talk, because I think there is a lot of value in being able to filter based on attributes, and then translate that to recipes. I mentioned mac and cheese. I swear, if my wife actually let me cook, that's what we'd have had all pandemic, right? Because they're just, especially when you have families with kids, I mean, the variety just isn't there. And I would love to have pushed a button and said, nope, give me something else today, right?
Yeah,
so
it still works for me.
Yeah, exactly. So that still works for me. So a lot of application there. I would not slow down. I would keep going with your pitches. And I really love also a great lesson that you just shared with all of us, which is the pivot. It's, hey, we kind of hit some dry spots, so we decided to take it back in house. We changed the product, and I know I'm very familiar with you guys. I understand some of the reasons why it didn't go forward as much. And to your point, it was because you were relying on a person to do the job and sell their own services in order to utilize to need your platform.
Yeah.
And so they couldn't justify their own ROI to stick around, let alone the ROI for keeping your product online. So
right.
It's the ecosystem that, and I think I started that as when Eller asked about what kind of things can the pitch involve. It's really looking at where does it fit into the whole ecosystem, and how can it help, down the line with a couple different areas, and then figure out who you're talking to and say, how is this going to help you specifically stay in business and continue to provide value?
Sure. Okay. Thank you.
Wonderful. Well, what a great way to wrap up this version of Distilled. Thank you all so much for joining. Jay, really great insights. I really appreciate it. For anyone that was on, we did record this session. Please feel free to share the recording with anyone you think might find this interesting or useful. We'll post it on our resources page on the Jumpstart Foundry website, but it'll also come out in a thank you email, likely tomorrow afternoon. So again, thank you all for joining. Jay, any last words you want to share before we all sign off?
Absolutely. Keep dreaming and keep bringing it to us. We're so excited to have all these ready. And the Foundry, thank you for bringing us this kind of smorgasbord of great ideas. I love everything you guys are doing. Can't wait to talk.
Awesome. Thanks, guys. Everyone have a great afternoon.